Hello, this is Kuldeep Chaudhary reporting from Health in India. I'm at Aarvy Hospital, Gurgaon, and this is 2nd of February 2012. We have a patient over here who's come from Nigeria, Ms. Tolulu, accompanied by her husband, Olukunle. They had come here for a GI surgery. This was basically a surgery for the removal of cysts from the ovaries. One fine morning, Tolulu felt some severe pain in the abdomen and she was rushed to a hospital in Lagos, Nigeria, where she was diagnosed to have acute appendicitis. The surgeons took her into the operating room, and while doing the surgery, they discovered a ruptured cyst. After her discharge from the hospital, her gynecologist advised her to take care of this cyst. This was about 2 years after they had been married and they had not seriously tried for getting pregnancies. Later on the advice of the gynecologist, they were trying to get the pregnancy, but the cyst kept on growing within the ovaries, and finally the gynecologist had to advise for them to go for a procedure called oophorectomy, which is the removal of the ovaries. This would have meant the end of their dream about pregnancy and having children of their own. The computer engineer husband, Olukunle, decided not to give up. He went on the internet and searched about the best possible treatment for this kind of condition. They came to know about this procedure being done routinely in India, and he got in touch with the team of experts at Health in India who advised him that several good doctors and hospitals are doing this procedure. On finding about the various costs, which were again very much different across various hospitals, they decided to choose Dr. Vikram Yadav at Aarvy Hospital to do this procedure. On the morning of 29th, on a very chilly Indian winter, they landed at the Indira Gandhi International Airport. Straight away they headed for the doctor's consultation, who advised them to go for a whole abdomen MRI, which was done at Modern Diagnostics. The MRI confirmed the reports which were given from Nigeria. The ovaries were full of fibroids. So Dr. Vikram decided to do the surgery the very next day, and on the 31st of January at 8 o'clock in the morning, she was successfully operated in a procedure which lasted for about a couple of hours. The ovaries were cleared of all the cysts, and in addition, hysteroscopy was done to remove the blockages from the fallopian tubes. Let us now talk to the patient and a delighted husband, who not only saved a lot of money by choosing Aarvy Hospital for the surgical procedure, but are on their last day in the hospital. Tomorrow morning, Tolulu is going to get discharged, and in the next 5 days, the stitches are going to be removed, and they plan to fly back home on the 12th of this month.
I think you can remove them.
Yes.
You had given her something to.
Yeah.
Yes, she's had liquids, except no vomiting, nothing.
No.
Passed through the motion, not passed. Motion also passed. Oh, great.
Very small. Then I went to.
Okay. And what about when you are passing?
What about?
Wind. Okay. Yes.
Just not yet. Almost, but not yet. I feel the movement.
And what about this pain yesterday you were doing? It's not there. Okay. What about appetite? You want to eat something? No. You are feeling that you should be eating something.
But what I want to eat, I can't get it.
Okay.
I have to get them to eat it.
Okay, what are you are liking? What do you want to eat?
I can't
Some milk products. Like
milk. I get this milk.
okay.
It's
Some non-veg clear soups and clear soups you can allow from evening onwards. Okay. You can have clear soups, and tomorrow onwards some breads and some soft diet, maybe some pasta and you can have from tomorrow onwards. Right?
Thank you.
Okay.
Oh my God.
Sir, very good morning.
Good morning.
Sir, we heard that you have recently operated upon a Nigerian female patient. So how difficult do you think was the procedure you did on her?
She was having previous surgery also for the same problem, and she was having endometriosis. And surgery in endometriosis is really very difficult because there are a lot of adhesions because of previous surgery and nature of the disease also. We find it's very technically very difficult to enter in the abdomen in case of endometriosis.
So have you done these kind of surgeries in the past also?
Yeah, we are almost doing 10 to 15 surgery in a month. This kind of surgery.
Of the same nature?
Of the same nature, because endometriosis is quite common in India as well as in the foreign countries also.
So are you very confident she'll be able to conceive in the times to come?
See, we are confident because we have cleared the bilateral ovarian cyst also, and we have ensured that her bilateral tubes are open. But the thing is, this is a recurrent disease. Sometimes some patients may develop again the same kind of disease. It's very difficult to treat them.
Okay, sir. Do we have alternatives to this treatment?
We don't have alternatives of this treatment because unless you remove the bilateral cyst, the patient is not going to conceive. Moreover, the patient is young, she wants to conceive. If the patient would have been an old lady, we can remove the tubes also, we can remove the ovaries also, we can remove the uterus also. But for a young patient who wants to conceive, this is the only option and this is the only hope that they should conceive.
So you mean to say there are no alternatives to this?
There is no alternative, absolutely, unless we give them hormones. But the hormones are again, they are going to deplete the women from the hormones and they will not conceive. So the only surgical option is available in these patients, and this is to be done.